Assalamu alaikum my dear students. Once again welcome to my YouTube channel by the name MS Lectures, and today I will be discussing you or explaining you about the neurology. That how to you can say check the lesions and how to you can say examine the patients, and furthermore we will be looking at the further details of the nervous system as well. So starting with how to examine the patient. If we talk about that if the patient you can say comes in the trauma center, if he has suffered from any type of injury, so what we what procedure we should need to adopt in order to examine the patient. First of all, we should need to look for a tremor. First of all, we must need to look for a tremor while walking. So what is tremor during the walking? So what is this tremor? What is this term meaning? Tremor means actually any type of involuntary movements that occurs or shaking of the body parts during the walking. So we have to look for this during the examination of patient. Then furthermore we have to look for the loss of facial expression. Loss of, if there is any loss of facial expression in the patient. Furthermore, we have to look for the speech. Have to look for speech, either the speech of the patient is normal or not. So this is known as the dysarthria, in which the patient is unable to speak properly. So this is the examination of patients. Now further talking about that, what is lesion? What is the lesion? What is lesion? So lesion is defined as any, you can say, types of the cells which are dysfunctional, disconnected and abnormal cells collectively, those are known as the lesion. So what is lesion? Lesion is a group of diseased, dysfunctional and disconnected cells. So this is the lesion. Now furthermore, after knowing that what is lesion, we will discuss that how to find the lesion. How to find the lesion, that where is lesion. This is a very important question, that where is lesion. So actually determining the location of the lesion depends upon the cognitive patterns of the sensory and motor deficit, which allows us to, you can say, localize the that where the lesion is present. So it depends upon cognitive patterns of sensory and motor deficits So this is all about that how to localize the lesion. Now furthermore, I would like to tell you about that how to determine the lesion. How to determine the lesion. Determination of lesion. So the determination of lesion depends upon the lack of symmetry. If you can say you find the lack of symmetry in the patient, you can determine lack of symmetry in that particular type of area where the lesion is present. So if there is the presence of lack of symmetry there, so you can determine the lesion. So lack of symmetry is the factor that can actually tells us that the lesion is present. Now furthermore, talking about the muscle tone. So these terms which I am explaining to you right now, these are very important terms in the, you can say, perspective of the neurology. So muscle tone. This is the partial contraction of the muscle in response to resistance for maintaining the stable posture. So this is the muscle tone. So this is the partial contraction of muscles. Partial contraction of muscles in response to resistance. For maintaining for maintaining stability. For maintaining the stability. So that's how the muscle grows. Now furthermore talking about the muscle fasciculars. That what are the muscle fasciculars? So muscle fasciculars are the non-rhythmical contraction. Fasciculars. So muscle fasciculars are the non-rhythmical contraction of the muscle fasciculars. So this term is known as the muscle fasciculars. So non-rhythmical contraction of muscle fasciculars. And furthermore talking about muscle myokemia, that what is the muscle myokemia? So muscle myokemia is the, you can say, flickering of the muscle fibers. So if there is a flickering of the muscle fibers, you can term this disease as the muscle myokemia, flickering of muscle fibers. So now I would like to tell you about the main superficial reflexes. That what are the main superficial reflexes in our body? So main superficial reflexes. So we have three reflexes. First of all, we have the abdominal reflex. Abdominal reflex. You can find this reflex at the level of T8, T9. At the level of, find this reflex at the level of T8, T9, level of T8, T9 and N1 and L1 to L3. Then we have another reflex known as the cremasteric reflex. Cremasteric reflex. So cremasteric reflex, it is determined by the testicular elevation. Cremasteric reflex is determined by the testicular elevation when, you can say, when you stroke on the inner thigh. So when you stroke on the inner thigh, so there is the, you can say, the outcome. What is that outcome? Testicular elevation. So testicular elevation elicited by the testicular elevation elicited by stroking on thigh. Elicited by stroking on inner thigh. Stroking on inner thigh. Stroking on the inner thigh. So this is the cremasteric. And last reflex we have the anal reflex. That what is the anal reflex? So anal reflex occurs by the anal scratch. By the anal scratch. So now we will discuss about the motor tract, and it has the three divisions. We have three divisions known as the pyramidal, extrapyramidal and cerebellum. Pyramidal, extrapyramidal, and cerebellum. So pyramidal is responsible for the voluntary movements. And extrapyramidal is responsible for the purposive movements. And cerebellum actually maintains the, we know that, maintains posture. Now talking about the pyramidal system in the pyramidal system in particular. So pyramidal is divided into the two upper motor neurons and we have lower motor neurons. extend from the brain till spinal cord. This is the notable feature of this. Extend from brain till spinal cord. Till spinal cord. And if you talk about the lower motor neurons, so it extends from the anterior horn of the spinal cord till the arms, feet, and body. So extend from anterior horn of spinal cord, anterior horn of spinal cord till arms, feet, and body. Till arms, feet, and body. Now we will talk about the primary motor cortex. We know that pyramidal system, which we have discussed just right now, is present in the primary motor cortex. So upper motor neurons of the pyramidal system is present in the primary cortex. So we will discuss that what is the primary motor cortex. So primary motor cortex. So first of all, we have to determine its location. That what is the location of the primary motor cortex? So location of the primary motor cortex is behind the precentral gyrus. If we thought that this is our brain, just examine it. So we have certain tracts. In this. So this region is known as the supplementary cortex. Supplementary motor cortex. This front region is known as the premotor cortex. And this is the region known as the primary motor cortex. This is present behind the precentral gyrus. You can see that. So if we encode the regions of the primary motor cortex, so we would see that those body parts which actually perform more movements have more space in the primary motor cortex, like our arms, feet, and body possess more movement. So these body parts will actually occupy more space in the primary motor cortex. So if we encode this region, so feet, arms, hands occupy more space in the primary motor cortex, because feet, arms, and hands has to perform more movements. That's why. So in primary motor, due to the more movements, excessive movements, you can say, and those body parts like hip, which possess the limited movements, occupy the less space in the primary motor cortex. So hip, which possess less movement, occupy less space in the primary motor cortex. Now after this we will discuss what is the corticospinal tract. What is the corticospinal tract? So talking about the corticospinal tract. So corticospinal tract is the region where it's 80 to 90% of the neurons lead to the lateral-spinal tract, and 10 to 20% of the neurons lead to the ventral spinal tract. This is the very notable information you must need to remember. that 80 to 90% of the neurons lead to the lateral spinal tract of the neurons of this corticospinal tract, and neurons of the corticospinal tract that are present in the 10 to 20% leads to the ventral corticospinal tract. This is the very notable information. Furthermore, we will discuss that what are the regions in the corticospinal tract that innervates the head and fascia. So, the head and fascia is innervated by the lateral fissures of the brain known as the corticobulbar tract. So, corticobulbar tract, corticobulbar tract present in the lateral fissures of the brain innervate the head and fascia. Corticobulbar tract present in lateral fissures of brain innervate head and fascia. Furthermore, corticobulbar tract present in the lateral fissure of the brain innervate the head and fascia. Now, furthermore, talking about the movements of the limb. So, anterior horn of spinal cord innervates the movement of limb. We know that corticobulbar tract innervates the movement of the head and fascia, and talking about the anterior horn of spinal cord. So, anterior horn of spinal cord innervates the anterior horn of spinal cord. Anterior horn of spinal cord innervates the movements of limb, or innervates the limb region. So in this lecture I have discussed the several aspects of the neurology and hope you have understood it well. And last but not the least, don't forget subscribing MS Lectures. Thank you.